Hi friends, thank you for tuning in to the Concussion Coach podcast. I am Bethany Lewis, the Concussion Coach. I'm a neurological occupational therapist and certified life coach, and I specialize in guiding people through their concussion recovery journey. I am passionate about helping people understand their injury, speed up their recovery, and reclaim control over their life post-concussion. The purpose of this podcast is to help increase awareness of concussions and the impact they can have on a person's life, and to bring hope to people who have suffered a concussion and those who love them. I firmly believe that sharing stories and knowledge about concussions will bring important light and understanding to this misunderstood and often invisible injury. The information in this podcast is meant to bring that awareness and hope and is not meant as medical advice. The opinions shared are those of the interviewees and my own. If you are suffering with lingering concussion symptoms, I have created a concussion coaching program specifically for you. I will be your mentor to guide you through your recovery journey, offering help with understanding and managing your symptoms, setting achievable goals, and learning how to manage your own thoughts and nervous system in order to get control over your life again. If this program sounds like something that would help you or someone you love, sign up for a free consultation. In the consultation, you'll get valuable information and resources and gain hope for your future. Sign up for your free consultation at the link in the show notes or at my website, www.theconcussioncoach.com. Hi, friends. Welcome back to the Concussion Coach podcast. I'm happy today to interview Brooke Eveleigh. Brooke is a registered physiotherapist and virtual coach for concussion care in the heart of British Columbia, Canada. She has an honors degree in kinesiology from Western University and a master's of physical therapy from Queen's University. With a special knack for busting concussion myths and a passion for nerding out on the intricate pathways of neuroscience, Brooke turns concussion rehabilitation into a personalized journey of recovery. She has specialized training in all areas of concussion care, prevention, acute management, and a particular love for those on a persistent symptom journey. Brooke and I connected on Instagram and discovered that we have very similar interests. And so I'm really excited to get to know her better and hear more about her approach to concussion care. So thank you for being here, Brooke. I'm so excited.
Yeah, thank you so much for having me. I'm really excited to connect. And I agree, Bethany and I were just chatting about how we have very similar concussion, rehab, and coaching outlooks. So this should be a fun conversation.
Yeah, I'm really excited. So let's start off by having you share a little bit more about yourself. And first off, to help clear something up for me, just because I'm not totally aware of how these things work. Is a physiotherapist the same thing as a physical therapist? And we just use different words in the US versus Canada?
Yes, exactly. And physical therapist kind of gets used interchangeably in Canada as well. Physiotherapist, physical therapist, same. In Canada, we have a master's degree versus the doctorate degree in America, but our scope of practice is pretty much the same.
Okay, thank you. I've always wondered that. I kind of figured that was what it was, but thank you for the clarification. So tell us what got you into PT and how did you end up focusing specifically on concussions?
Yeah, PT is something I wanted to do for a really long time before I got into it. And it kind of felt like such a nice, happy middle ground of healthcare where you get to spend a lot of time with your patients and really get to know them, but also really get into the nitty gritty of assessing and treating and stuff like that. So it felt like such a happy middle ground for me. Particularly in Canada, our system is very overwhelmed. Healthcare in general. And so a lot of public practice and things like that are it's so rushed. You don't really get to know your people. You don't get to know your patients the same way. And so that's something that I love that I get to do in physical therapy. And I feel like it's such a benefit to both for myself and my love of what I do and for my patients because they really get to be listened to and understood. And we just have that longer time to connect on things. And then concussion care kind of gets rolled into there. When I was in my undergraduate degree, I was working with teams and working with athletes. And while we knew even so much, concussion care is evolving constantly, as we know. There's so much to keep up on. But even when I was in my undergraduate degree, we knew a lot about how to identify concussions, how to manage them, how important it was to not let people go straight back to their sports. And I wasn't seeing this happen in actual practice. And it kind of lit this fire in me. And I was so rattled about it because I was why is nobody caring about their brains?
Right.
So I was what's going on? We know these things. Why isn't this getting put out there more? So I've been on a journey since then of training in concussions, having my own concussion mentors to teach me, taking different courses, digesting as much info as we humanly can because there's so much out there. And trying to translate that into better care and evolving access for people, which I think is like, as you know, such a hard problem for concussions. People don't even know that you can see physical therapists for concussion care sometimes, and they don't know where to go, which is like one of the big problems.
Yeah. Yeah. So true. So have you worked in concussion clinics specifically, or has most of your work experience been in the sports world? I'm curious how you started your own business. Like, how did all of this come about?
Yeah, it started with sports and athletes when I was in university, and then kind of evolved more into a private practice role. And currently I work in a kind of sports heavy, I would guess, private practice clinic, which is not my clinic. Like I clinically work out of Parkway Physiotherapy in Victoria for anyone who lives in Canada. We're on Vancouver Island. And then outside of that, I have more of this kind of like education thing that I do on Instagram where I'm sharing tips and resources, and have recently also started in the concussion coaching space. So I do some one-to-ones virtually, and also I'm building out a group program. So those are kind of the different pieces of where I work in the concussion world right now. Clinically though, my caseload at this practice, while it is not a concussion specific clinic, my caseload is pretty much concussion specific. Like 90% of my caseload is acute or persistent concussion management.
Okay, awesome. So yeah, you have some good experience there. That's really cool. And yeah, when you're talking about getting into physical therapy, that was similar things that brought me into occupational therapy. I wanted one-on-one with people. I really love the helping and in that like more intimate setting where it's just like you and them and family members or whoever's there, but like you just get to really make a difference. It's a beautiful thing. I love therapy, and I love the coaching part too. It kind of expands options. So yeah, and I love what you're doing on your Instagram page as well. So everybody, you should check it out. It's at concussion.physio, and the information you share is like it's bite-sized and really helpful and has a really pretty color theme. So like it's really, I love it. And I'd love to chat about some of the things that you've posted about that or on your Instagram, because I do think it's really important information to get out there, and the more ways we can do it, the better. So let's chat for a minute. I know you're passionate about, like you said in your bio, you're passionate about helping dispel the myths about concussions. So there's a lot of those circulating. Let's talk about that. What are some of the top myths that you have come across, and tell us why they're untrue?
Totally. I think it's always helpful to go over like the basics, because so many of these things I hear when clients come in. Oh, I don't think I had a concussion. I didn't hit my head. Like that's kind of a classic one. Or my imaging was clear, so I must not have a concussion, things like that. So I like to get those basics off of the list right away. You do not need to hit your head to have a concussion. Any kind of like force that whips your head or a whiplash type motion can definitely cause a concussion. And so that is not a definitive cause or not. And then the imaging one is so common. I see patients, especially in our system here in Canada. So I'm not sure how easy it is to access imaging for clients that you're seeing, Bethany, but here it's very challenging. Like if you need an MRI and it's not an urgent, like life or death situation, you're waiting like 4 months to get that. And so if I have these people who are sitting at home being like, oh, I got to like wait to see what the imaging says to know what's going on, we've like really lost that early intervention period for those patients when they're sitting to wait to get an image, which will not tell you if you have a concussion or not. Yes, it will not. So I love to get those ones off of the myth busting list right away. And then I think the other one that kind of gets jumbled up a lot is just this recommendation that gets put out a lot from what I see from just general healthcare providers or like people in hospitals or other family and friends who say like, oh, just like go home, wait a couple of weeks, and then like just slowly get back into your things. I really hate this advice because it feels well-intentioned from the person who's giving it, like, oh, just take your time, get back into it. But then we've kind of set this person's expectations for, oh, I just have to take it easy for 2 weeks and then like everything will just go back to normal on its own. Yeah. And we know from research that there's like, I think new research is saying like at 6 months, like 40 to 50% of people are still not back to what they want to do and what they were doing pre-concussion. And so if you've missed this like early access period of those first 2 weeks, then we've already set you up for having persistent concussion symptoms. So to kind of curb that myth, I guess, in a very roundabout way of me to get here, if you have a concussion, if you are talking to someone who just had a concussion, tell them to go see a concussion literate provider ASAP, because the best case scenario is like you just see them a couple of times and like you get back to your life and things are fabulous.
Yes.
And then on the flip side of that, you just completely avoid this persistent concussion period, or you're on the right path from the get-go to avoid it from lasting years and years, which sadly we see still so much.
Yeah, so much. And that's one of the things that just it feels like a knife twisting at my heart every time I hear it. But I was told just to go and sit in a dark room until I started to feel better, and then I would be okay in a couple weeks. I was like, no. And maybe that's not exactly what they were saying. Yeah, it's possible too that, maybe that's not what the provider said or intended, but that's whatever it was, that's how it was interpreted. And so I think, there's a lot of room for improvement in the communication and just, getting this information and understanding about concussions out there. Because again, I think a lot of times, and I think you mentioned this on your page, if I remember right, but there are a lot of providers, medical providers out there, and not a lot of education that goes in their education and getting the degrees into concussion, which it makes sense. There's so many things to learn and so many things to specialize in. But if you're not specializing in concussions, then there's a high likelihood that you don't know all of the things about concussions. And so I agree, getting into a concussion literate provider right away is really beneficial. And I want to come back for a second to the imaging thing. Can you help our listeners understand why it is that imaging, people think that you should be able to see if you've had a concussion, but that's not the case. Why is that?
Yeah, it's a great question. And we get asked this question so much as providers. So basically, concussions are more of a functional injury, meaning that the processing of what's happening in your brain, so how you're interpreting and interacting with your environment, is getting thrown off, versus more of a bleeding or a bruising or any kind of structural or big structural change. And this is something that we think is happening with concussions, that there's microstructural damage to axons and neurons and things like that. But it is so micro, this is not perceptible on our classic imaging, MRI, CT scans, things like that. So this is something that the concussion research space is evolving in a lot, trying to work on. How do we diagnose this? How do we know for sure this is what's going on? And I always forget the name of what DTI stands for, but it is some kind of image that's used in research settings that measures water molecules and how they're moving around in your brain. And that can pick up some changes, concussion or non-concussion, but that's a very research-based application and is not easily accessible or used.
It's not what they're going to do if you go into the ER.
Yeah, exactly. We're not using these fancy hydrogen molecule assessments to see what's going on with your brain structure, especially when it's so microstructural. But the key is that it's a functional injury. You're having these symptoms. The symptoms are real. You are having difficulty with visual motion or dizziness or headaches or whatever your symptoms are. And the fact that we can't see it on an image doesn't make it not real. It just means it is not at a level that we can perceive it on these images because they're just not good enough for that. And so that's kind of the big difference I like to identify for people.
Yeah, thank you. I think that was well explained. And these are taking pictures of things that are not, it's not what we're looking for in a concussion. There's a scan that they use at the clinic that I work at. They call it the FNCI. It's a functional neurovascular coupling imaging. And so it's similar. It's looking at that, how the blood flow is working when you're doing specific activities. And so there are some things out there, but it's very specialized and it's not what you're going to get if you hit your head and go to the ER or the doctor's urgent care. They're the typical things are CT scans or MRIs or whatever. And that's just not going to show you. So anyone listening, even if you've had an MRI that's come back and they're like, oh, you're fine, that doesn't mean that you have not had a concussion. So thank you for pointing that out. So let's talk a little bit, since you've had a lot of experience with that more acute concussion stuff. Can you tell us general advice for people who've had a recent concussion and are wondering whether they should seek medical help or not?
Yeah, for sure. And I would always tell somebody to seek out the like concussion literate provider. Even if you're not sure you've had a concussion, that's probably the best time to go, is because you want somebody to help kind of guide you on this path. And like I said, avoiding persistent concussion symptoms is so important in those early stages, because once you're past a couple of weeks, like you're pretty much already in persistent symptoms. So if we can get you out of that beforehand, that is where the talking to a concussion literate provider is so, so important. And in those first couple of days, we do have research and evidence, and I see this clinically as well, that a couple days of rest is super valuable. Take it easy. If you don't feel like doing something, don't do it. Kind of eat when you want, sleep when you want. Really take those couple of days to just kind of like assess what your body needs, pay attention to like what your body is asking for, which is hard in like a productive, busy society that we try to all fit into all the time. There's like pressures and things we want to do and kids to take care of and relationships to have and stuff like this. But really in those first 2 days, only doing things that your body feels like are good and comfortable is where you want to spend your energy. Take a couple days off work or school, really rest, sleep when you want, eat when you want, things like that. The staying away from screens recommendation, which I hear so much, we do have some good evidence that staying away from it for a couple of days helpful, because it's just so visually, there's a lot going on. We've got social media, we've got like busy images on TV and movies and things like that. And it can be pretty cognitively taxing to process all that information. So I always say staying away from them for the first 2 days is beneficial. But then after that, you really want to gradually introduce all of your normal things like that back in. And if you spend 10 minutes on your computer and then you're like, you know what, I don't feel so good. Great, no problem. Close it, put it away, give yourself a little breather, try it again later. But I see a lot of issues come up when people take the rest or the no screens or the no driving to the extremes. And then we're like months down the road and you haven't opened your computer. And now you can't look at a computer because it's been months and that's way too stimulating. And so that like slow, gradual introduction of things is so, so important in those first phases. Because if you stay in that dark room, like you said, Bethany, if you go home, you stay in a dark room for a week, you're going to leave that room, you're going to be light sensitive. There is no question about that. Anyone would be light sensitive.
Yeah, whether you had a brain injury or not, you would have that.
Exactly. If you lived in a cave for 7 days, you're going to be light sensitive when you come out. And so we just don't want to take any of those things to the extreme, except not doing anything where you could get another concussion. That one I take very much to the extreme on the first few weeks, avoiding all things where you could hit your head, returning to sports too early, things like that. That one I say is not really a gradual exposure in the first couple of days, but definitely more of like a hard stop for a couple of weeks.
Okay, that's a good qualifier there. Thank you. And just curious, what's the recommendation for when to return to sports and return to play?
This is definitely a hot debate, I would say, with a lot of sports teams. And because we see professional athletes and professional sports usually use this like 7-day return to sport protocol, but that gets trickled down into like minor sports and athletes and stuff like that. But really, we have so much evidence that your brain is not healed when your symptoms go away. And so there is this little bit of a lag where your brain still needs, whether it's rehab or a slow introduction or something like that, to get back to normal. And that our brain energy can take anywhere from 21 to 28 days to really like get back up. And so I really push my athletes and my patients to a 3-week return to play protocol. And this is based on the research that your energy in your brain is not back to normal, and your like metabolism in your brain is not back to normal for those first several weeks. And so we will start like exercising ASAP whenever we can. Like that's my favorite intervention, if nobody can tell from my Instagram. We'll start exercising as soon as like your brain and your body are ready for it. And then maybe we start doing like sport specific drills when that feels ready. But I I don't let my athletes go back to sports, full contact, full practice, full games until at least 3 weeks, assuming all the other things have gone really well. Otherwise, it could take longer if they're still having symptoms or difficulties. But I know this is a hot debate and can be a challenging thing to educate patients, teachers, athletes on when they see this kind of standard 7-day protocol in a lot of other kind of like professional leagues.
Yeah. And I imagine it's probably a hard sell too, because I know that I've talked to a lot of people who had injuries in high school and the athlete doesn't want to stop their sport. And 3 weeks seems like a really long time, I'm sure. And the parents are probably like, no, let's get them back in. Or they're on the other extreme, like, no, let's make sure their brain is okay. It's probably see both. But how do you address the concerns? I'm sure they come back and they want to push back on you for it. Like, what have you found to be helpful emotionally in helping them be okay with taking those 3 weeks?
Yeah, for sure. And you're right. It can be like definitely like a difficult subject to broach, especially when your like identity is wrapped up in like, this is your life and this is what I do. And I'm an athlete and this is my sport. Those things can be so hard to hear somebody who doesn't know you very well yet say, hey, you can't do this for 3 weeks. Yeah. And so I do try to be very like sensitive about that and be like really work with them to get to a place where we can both understand what their needs are and like what will be best for them. But I am pretty strict on this protocol that I recommend. And the way that I have found it successful to explain to my patients and clients is really actually walking them through that like energy metabolism thing and saying like, after a concussion injury, your neurons get stretched, releases all this stuff in your brain, your energy kind of goes haywire. And then we get into this like low energy phase. And when you're in that can take the 21 to 28 days to kind of recoup based on what research says right now. And if you get another concussion, when you're in this like low energy phase, that's when it's dangerous. And like scary things can happen, like we've heard of relatively rarely, but it's called second impact syndrome, which can happen when you're in that really low energy state. Or you get another concussion, and I don't know if I can get you back to your normal if you get a concussion in that low energy state, because now we're so much further from your baseline. But if we give it these 3 weeks and we do your rehab and we follow all the rules and we gradually expose you to things that your brain can then get used to again, then I can get you back. And like, I know we'll be able to get you back to your sport. And this doesn't have to become a long-term thing. But I think really bringing home the point that if we get another injury in that low energy phase, that I don't know if we can get you back to your baseline, or this is going to get harder to get out of, or maybe we're persisting your symptoms for years and then you're not going to get back to your sport in a couple of weeks. And while I know that maybe sounds like a little bit of like a fear tactic, which is not the goal, more like just an education tactic, because we see all this stuff from like socials and media and stuff where like nobody does this 3-week protocol, or very few do. There are some sports organizations that do, which I appreciate. So it can be just a hard thing to kind of wrap your head around. And the first time you hear something and it kind of conflicts with what your brain already knows, it can be a hard one to kind of grapple with initially. So I do find some success in like kind of teaching that energy piece to my patients and showing them that like, this is our best opportunity to get you back ASAP. And I don't want to mess that up. I don't want us to go backwards because we went back 1 week too soon. Like, then we're going to look back on that and regret that so much.
Yeah, I think it is. I think it's really helpful and important to educate people, to let them see this is why we do it this way. And I think for anybody who's listening out there who had a concussion more than a week ago, more than recently, and they did go back earlier, there's still hope. I just want to like make sure, and we'll be talking more about that too. Like even if you did it quote unquote all wrong, like there is hope and healing is still possible. But like you were saying, it might take longer. It might be, we don't know if you're going to be getting back to the sport altogether, or at least anytime in the next little bit. Like it might extend the period. So I think that education is really important and really good for people to know. If it has been a very recent concussion, get it taken care of right away. Like, let's do that. But if you have had a concussion, it wasn't recent, don't lose hope. It's okay. There are still things, and you can still find healing and recovery from that. But it's it's like a balance. You got to figure out how to explain that. If it is recent though, really important to seek that help and to take, I love and totally agree with your approach of a couple days, rest, take it easy, and then start reintroducing things expose the brain to stimulation again and like get it back. So can you talk to us about, I know you had a post about the different subtypes of concussion. So what are they and why is it important for people to know what subtype they might have?
Yeah, it's a great point, and I do find that a lot of patients or clients on a journey like this are not aware of this until a provider kind of lets them know that there are different kinds of it. And that's why everyone's presentation is so different. Like everyone's concussion journey is going to be individual and unique. Your recipe for recovery is not going to be the same as another person's. And I know we're all looking for that like magic bullet, like what is the recipe that will work? Unfortunately, it will be different for everyone, which is why it can be a challenge. But when you find your providers that are really doing like a deep dive on your assessment, so like multi-systems assessment of all of these subtypes, then you can identify your recipe so much more easily. So to your original question, actually, Bethany, what are the subtypes? So on my Instagram, I have them broken up into 7. And typically there are 7, but I guess a caveat here is depending who you talk to, they will label them slightly differently. And I'll explain as I go kind of why. So number 1 for me is cervicogenic. So that's your neck. It's very hard to get a concussion without also injuring your neck. In fact, impossible to reach the threshold of a concussion injury without surpassing a whiplash. So always looking at the neck. Visual dysfunction. Vestibular dysfunction, which for anyone unfamiliar with that term is your inner ear, your sense of where you are in space, and any kind of dizziness related symptoms often come from here, not always, but often. Then we have the cognitive category, so that kind of like processing piece of cognitive information, understanding, memory, stuff like that. We have mood, or also known as affective. So the anxiety piece that can come with concussions, the depression, isolation, like those kinds of changes in your mood is a subtype. One of my favorites to deal with, autonomics. And I feel like from your Instagram also, Bethany, working with like the nervous system and those kinds of things are something that we both kind of relate on a lot, that this is such a huge driver of persistent symptoms. So autonomic nervous system, for any listeners, is how your nervous system is interacting with all of your other systems in the body. So is your system feeling safe? Is your system feeling unsafe? And then how does that kind of lead into your symptoms? And the other category that I've kind of broken my 7 into is metabolic and hormonal. So as a physical therapist in Canada, that's not in my scope of practice. But if I've assessed all the other categories and I'm finding not a lot in your multi-systems assessment, then I'll refer you out to like a naturopathic physician or your GP to kind of get your hormones and things like that checked out. A couple of other categories for any listeners that you may have heard is kind of a sleep category. And I don't identify this as its own category because I usually find it's driven from other categories already, usually nervous system. And so I always work on sleep hygiene and sleep routines with my patients, but I don't like to call it its own category for that reason. I feel like there's another driver. And similarly to why I also don't use the headache category.
Okay.
There is a post-traumatic migraine / headache category of concussions that you might hear providers use. But again, I usually find if patients are presenting with headache, which is one of the number 1 symptoms, that one of your other systems is driving that. Your eyes are not working very well together. That's giving you a headache. Your inner ear feels off. So you're dizzy. That's giving you a headache. You're not sleeping. That's giving you a headache. And so I don't find putting someone in the headache category that useful for treatment. And I really use those subtypes to kind of like drive my rehab protocols. And so for anyone on a concussion journey, if you're trying to find a provider or you're wondering if your provider can assess these symptoms, it's a really good way to kind of chat about it. Like, what's this? What subtypes of concussion do I have? Where should I be focusing my energy? Do I need to be doing this neck exercise if most of my symptoms are coming from my eyes? Things like that. And it really can help as a patient to understand why you're doing an exercise or why you're doing a breath exercise, to know what subtypes you have and how that relates to how you get better.
Okay. So thank you for explaining those. I've found that it seems like, and maybe this is part of why there's different ones out there, but it seems like a lot of times people have a lot of these, if not all of them. Is that what you found as well?
It is really common to not be in a single category, for sure. I feel like I can probably count on one hand the amount of people I've seen who have like one category left over, for example, in their rehab. But the beautiful thing about doing like the big multi-systems assessment is I'm like, okay, this is what we're doing for your neck. We're checking your eyes now. We're checking your vestibular system, yada, yada, is that I can identify which ones are actually there. And your symptoms just can't always tell you that. Like I said, headache feels more like a symptom and less of a category for me, but any one of those subtypes can give you headache symptoms. And so knowing your symptoms and what your triggers are is important, but it doesn't always lead us to what your treatment should look like. If someone comes in and tells me their main complaint is dizziness, I don't automatically assume they have an inner ear problem. That could be an autonomic nervous system problem. Your system is feeling stressed and anxious about being in a certain scenario, and that's making you dizzy. Your neck, not knowing how to hold your head up in space, can make you dizzy. Your eyes not working well together when you're tracking in like a grocery store looking for something on an aisle, that can make you dizzy, or also your vestibular system. But the symptom alone doesn't tell us what's going on. And that's why it can be so important to break it up into those subtypes.
Okay, cool. Thank you for explaining that. Yeah. Personally, I haven't delved into these subtypes a lot, but I cover all of the, like it's definitely all of those things are things that we look at, but I like this. It's helpful to say, okay, this, and there are certain patients that come in and they have like 5 of them, but not this other one. So that like, it makes sense. Like, okay, it can impact all these different systems. And a lot of times I do think that the systems are interacting with each other, and your vestibular system and visual obviously are really, really closely tied. Autonomic kind of can impact all of it as well. So it is very complex and very complicated. So having specific things to look at, and not just, like you said, not just saying, oh, you're dizzy. Okay, it must be vestibular. Let's do this. I think that's really important and really helpful and good for people.
You made a good point that they all work together. They interact completely all the time, which is why the symptoms all look so similar. But breaking it up really gives you a really good starting ground for rehab or exercises or what you need to do to get back. And then we start kind of tying them in together. Okay, now we're going to do a neck and an eye exercise together, and then we're going to add a cognitive task on it, and then you start to kind of like layer and stack, which is how life actually works. We use all the systems together all the time, but it's hard to start from that high level of let's use them all when individually they're not working at their best to begin with. I think that's so important, like looking at them individually, working on them, and then also working the whole thing. It's really good. So I love that in one of your Instagram posts, you talk about how it's important to not just push through symptoms, but to alternate periods of activity with rest and recharge. And this is also something that I feel very passionate about and that I discuss with my clients all the time. So what things have you found to be particularly effective in helping people figure out when to rest and when to push? That's a hard thing. Totally. And I'm sure, especially in occupational therapy, it is a topic that you guys would have all the time, the pacing and prioritizing and like, how do I use my energy efficiently, but not too much? It's such a common struggle with concussion. Like I said, we're in that like low energy state after you've had a concussion. And then if we think about your systems are not working at their best after your concussion, whether we're talking weeks, months, or years down the line, to do a task that used to be efficient for you, we now need so much more energy to do that task. So that's why pacing can be so important. And pushing through your symptoms, I really find that just teaches your system to be more threatened by those activities. Yes. And so that is why I am also I do a lot of education on the like pacing piece as well, because if we're constantly doing something and every time you do it, you get a headache for 3 hours after, we've now taught your system that this is a dangerous activity. Don't do this. It's not good for you. And then your nervous system starts to get even more threatened by those things. So I really like to use, probably my most common analogy is the rechargeable battery one. So when you wake up every day, we might not have a full battery post-concussion. Maybe you're not sleeping well or you had a heavy day the day before. So your battery is not fully charged. So if you're doing an energy draining task and you think about that battery kind of like being drained little by little, we really don't want to wait till you're like absolutely at zero battery to then take the rest, because then you've completely drained yourself. Now you need maybe a whole day, maybe a week to get back on your feet to do another energy draining task. And that can be the most frustrating space to be in as a patient, where you're like, oh, I had some energy, I did this thing, and I got nothing after that.
Yes.
So that like whole like boom and bust energy thing can be so hard. You're like, oh, you know what? I feel like I can do something today. And you go do it. And now you're like, now I'm laid out for a week. That is so frustrating and can, just prolong that process. So if we think about it like a rechargeable battery, you have the capacity to build that energy back up in the day, but you really do need to pace the activities. If we're waiting until you have nothing left, then maybe you need a week to recharge, versus like, oh, I broke this task up into smaller pieces and I took breaks along the way. And now maybe I only drained a little because I kept recharging as I went. And now I'm back to my baseline anyway.
Yes. I love that.
Nobody can see my little, I know we're on a podcast, and nobody can see my like visuals that I'm using with my hands for the rechargeable battery. But hopefully I explained it well enough.
I think you did. You're good. Yeah. So like it varies. It goes up and it goes down, but you don't want to let it drop all the way. And I think one of my friends, Kaylee, she talks about, I like her way of describing it. It's like you want to be proactive and not reactive to these things. Like you want to, if you take the time ahead of time to rest and recharge, then it extends your capacity to continue to do things that you want to do, rather than, like you're saying, like push through, drain it all the way, and then it takes a long time to recover from something like that. And it's an emotional game too, right? Like it's hard emotionally as well as physically to do that bounce back and forth. So being really intentional and paying attention to the signs and symptoms that you have going on before it becomes really problematic. And it can be hard, because I know a lot of times people will say, well, I don't know what activities did this, because it's delayed sometimes. I don't feel bad until the next day or hours later. And then, so it's a process. It's like figuring out your body, your system, how it's responding to things, but being proactive and taking those rest breaks. Even if you don't know when you need it, like sometimes it can be helpful to just like set a timer and be like, I'm going to take 10 minutes right here. So, and that kind of leads us into what things have you found that are particularly helpful as those rest and recharge activities? I know you posted about meditation, which is awesome. I'm also a huge fan of mindfulness meditation for both myself and my clients. But what other things have you found to be helpful for people in de-stimulating and resting?
Yeah, and like we've kind of touched on already, it can be so unique for every single person, like what their body gets recharged by. And maybe a walk for someone is recharging, and for another person, that's just like completely draining. So it does take a little bit of kind of trial and error, and a lot of really just like getting into your own body and like learning how you feel after an activity and kind of assessing your energy after those things. So I do love to recommend meditation. And while that can sound like a scary word for some people who kind of have a busy mind and things like that, it can feel really unsettling to like just sit and think about breathing or think about your body. It can be a really uncomfortable feeling for a lot of people. And so if we can get to a space where that gets a little bit more comfortable, then I recommend it. But for some people, that's almost like more triggering, because they're like, I don't like this, I feel uncomfortable. And like that can induce a bit of like unease and anxiety and energy draining, because it's a new task for you. Mm-hmm. So while I do love meditation as a recharge and really like to focus your brain and think about your breathing and let your mind wander and then bring it back and things like that, there's so many other options for rest and recharge. So like going on a walk, listening to a podcast, or like listening to some music that you like, something you're familiar with already that's not going to take a lot of cognitive energy from you. Snuggling with like a pet, or like just sitting and drinking some tea in the sunshine or something like that. Like for every single person, it's going to be a little bit different, but you want to maybe identify things if you're listening and you're trying to figure out, well, like, I don't know what my recharge is. Things that make you happy can be very recharging, even if they do require a little bit of cognitive energy. And so if you're noticing things that like, oh, you know what, I went on a walk today for 10 minutes in the sun and I felt lighter after, great. Then that 10-minute walk might be a recharge activity for you. And if you tried a 10-minute walk and you felt terrible after because maybe you have a symptom that gets bothered by heart rate or vestibular, then maybe you try some stretching, something lighter, something lower energy. But it is a little bit of trial and error, which I know is not the easiest recommendation. But yeah, identify those things that you like and that you feel maybe like lighter or more at ease after, versus trying to think of like, how do I like rest and how do I like protect these things, is maybe an easier way to think about it.
Yeah. Yeah. I like that. Yeah, it is. And it's so individual. Like find what helps you. And it might even change in the recovery process as well. Like at the beginning, a walk might be overstimulating, then down the road, it might be the best thing and you might love it. So be open to trying things again and experimenting. And yeah, really it is so individualized, but there are a lot of options. And I love the ones that you brought up. I think that kind of like a couple that I like as well is mindfulness, which I think is meditation and mindfulness are very similar, but yeah, like going into your body, being in the present moment and focusing on what you can see around you, what you can hear, like it gives your mind something to focus on that's here and now and not in the past or the future where usually anxiety or worry or sadness lives. Like if you're right here, right now, breathing, usually we're okay. And so that can be a helpful strategy. And yeah, I love the walks. I know people have talked about, finding the music that helps. Yeah, there's a lot of things that you can do. So find what works for you. And if you want to comment on here on the podcast, like, and tell us what works for you, I would love to hear the thing that's their thing, because everybody has some different things. So maybe I'll do an Instagram post on that, because I would love to hear everybody's ideas. There's a lot of things out there, but that's awesome. Thank you for sharing those.
Yeah.
So let's shift gears a little bit. We're gonna jump onto another of your posts about tips for screen time post concussion. And you touched on this a little bit, but what other things do you want people to know about screen time and how to handle that when they have light sensitivity and concussion symptoms going on?
For sure. It's a really common question and can be like a common fear post concussion on like, how much is too much? Am I hurting my brain? Things like that. So all of those like fears around it are super normal, but it can be a safe and easy thing for your brain to get used to again. We just have to kind of do it in a graded, gradual exposure type way. And so the things that I like to recommend right off the get-go are, if you're listening to something or watching something, slow down the speed of it. If your cognitive processing is a little bit slower than it was maybe pre-concussion, sometimes you just need a little bit more time to process that information, and it can be really overstimulating to listen to something or to watch something that's moving faster than you can process it. And so that's a common one that I don't see posted about enough, is to slow down the speed, put it at half speed if you're watching a YouTube video or you're listening to this podcast, for example. That is a really great, it's a really good one to like help your brain keep present and be mindful and pay attention to what you're listening to, and not lead to that like frustration of like, oh, I'm getting overwhelmed. I don't know what's going on, because it's going too quickly.
Yeah, that's so simple. But yeah, it makes sense. Like if your processing speed is slower right now because of a brain injury, then slow down the things and it won't be as stressful for you. And for people who are listening who may not be super tech savvy, how do you do that?
Yeah, totally. So whatever podcast app or wherever you're listening to these, if it's on YouTube or anything, usually there's like the little settings. Usually it's a cog wheel of some kind, like a picture of settings. And then you go to playback speed and you can make it slower. You can make it like 0.75 or 0.5 times. And then maybe at some point in your recovery, you're feeling like this doesn't bother me anymore and you want to more efficiently listen to something, you can speed it up. So you can kind of play with it however you want based on where you're at. But it's one that I don't see posted about a lot. So I always like to bring that up, because a lot of us have heard of like blue light glasses or like the screen modes where you like darken the screen and stuff like that. So those are a little bit more prevalent, but the speed one can also be important.
Yeah, I love that. Can you do that? I know with YouTube and podcasts, you can. There's not, as far as I know, are there no settings to do that on like watching TV or a movie?
I don't think so. Not that I have actually explored, but that is a great question. And I'm going to go on to my Netflix later
Yeah,
and
maybe I'll have
figure
to play
out
with it.
if that is I'm going to go on and figure out if that is a thing for like podcasts, YouTube videos, those things 100%. You can kind of slow down the speed, but it's a great question whether you can do that with like TV or movies and stuff like that. That would be good to find out.
Yeah. Okay, cool. Thank you. Yeah, I was just curious. It's like I said, this is the first time I've heard that idea and I love it. So thank you for sharing that. Sorry, keep going.
And I guess,
Tell us more.
yeah, I can talk a little bit more about kind of other screen recommendations if some of the listeners haven't explored some of these. So on a lot of devices, whether it's like your phone, your computer, desktop computer, laptop computer, tablet, there are modes called dark mode or night mode or night shift. And these can kind of take some of that like really harsh blue light off of your screen. And it makes the screen maybe a little bit more yellowy or a little bit lighter. And so it's not so much blue light coming at you. And this brings me to the point of blue light glasses, which in general society have been promoted for like a while about how they're good for us because we spend a lot of time on screens. But there are benefits to blue light in the morning because they help your circadian rhythm set, and you actually like learn that it's daytime. And especially if you're having sleep problems, this is super important. We should kind of like be waking up with some blue light in the morning with the sun and things like that, telling your brain that it's daytime. And then maybe in the evening you have to be on a screen for some reason, or you're watching TV, or you like need to check your phone. That is where blue light glasses can kind of come in to reduce that stimulation, that cue to your brain that it's still daytime, because we want to trigger sleepiness at nighttime to help you get to sleep. So if we're kind of messing with that right from the get-go in the morning, putting our blue light glasses on, blue light blocking glasses on immediately, that could be actually inducing some sleep problems and circadian rhythm problems. So I just want to caution people about the blue light glasses for that. They're not bad for you. Just be particular about when you're using them. They're designed more for evening use versus morning use.
Good to know. Thank you. That's really helpful.
And another one, I guess the changing the settings of your computer. There are different softwares you can download. One of them that I recommend, which is free, is called Flux, F.lux. It's a software you can download, and it kind of like changes the tone on your computer. It's not so harsh. It's not so bright. And that can be a helpful one for anyone finding that it's just very stimulating to look at your screen. And then on the this is a big recommendation, like an expensive recommendation. On another extreme is called like a flicker-free screen. So computers give off this we can't perceive it visually, but your brain can perceive the flicker of what's going on your computer screen. And so that can be really tiring for your brain. So there are screens that are flicker free. They're quite expensive, but they do exist if this is something you're having a lot of difficulty with. And if you think about like a Kindle or a Kobo, like e-readers that have that kind of flat look to them, that is kind of what a flicker free screen looks more like. So it's a lot less stimulating. So it's not as bright, it's not as harsh, and it doesn't have this background flicker that your brain can perceive even though you're not visually seeing it.
So with that kind of device, would that be something that someone I imagine that it would be helpful if they are on a screen all day for work or whatever, if they could get something like that, and that might allow them, they could still watch a movie or something later, right? It would just decrease the amount of that flicker that their eyes are seeing throughout the days to allow them to be able to handle other things maybe. Is this something also that you would have to, how long, is this something that you would recommend for people to have as this is your screen from now on? Or is it something okay, this is maybe a temporary help until your eyes recover all the way? Or is it just generally a helpful thing to have?
Yeah, that's a great question. And I don't personally have a lot of clients who use them because they're a really big investment. Mm-hmm. And so usually my approach is more on the kind of gradual exposure. We'll try for 15 minutes and then you do something restful and you palm and cover your eyes, lay in the dark for a few minutes, kind of reset, those types of things. And so I don't have a lot of clinical experience with that many patients using them. The one patient I can think about who did invest in one of these because they had a pretty screen heavy work life And this is something they were like, this is the priority. That's what they wanted to get back to. And as far as I know, she's still using it. And so I don't know if there's a point where it becomes beneficial to not use it, or if it kind of just is a replacement in itself and you've invested in it and now your screen is a flicker-free screen. I don't know if there are benefits to that in general also. So maybe using a flicker-free screen for long term is actually good for us. Your brain doesn't have to process this background all the time. Maybe that frees up some energy for everyone. I have no idea. But it's it's a really good point. I don't know anyone that has used it and then come back off of it, but it's an interesting point.
Yeah, and was it helpful for that patient? Was it did it make a difference for her?
Yeah, for sure. And I think you made a really great point too about if we can allow you to get through your workday this way with the flicker free, then you've freed up your evening to do something with your kids or do something else that's energy taxing that you wouldn't have otherwise had the energy for because the screen was your trigger all day long.
Right.
So that can be super, super valuable.
Yeah, I love that. And I think it's one of those things that people don't realize, especially the vision. If the vision is an underlying issue, and a lot of times people come in not realizing it, you can go and you have an eye test done and you can see you have 20/20 vision, you think you're fine, but your eyes teaming and working together is the problem. Or the light sensitivity, all these different things. The visual system is such a major part of so many, all of our brain, such a big portion of our brain, that if things are not working well there, it's this underlying thing that can really be draining our system. And so getting the vision, vision therapy or vision, something to help with the vision can really make a big difference. So I could see how having a flicker-free screen or something to reduce that demand would really make a difference for people. So those are helpful. Thank you for those tips.
You're welcome.
And I guess this can kind of be related because vision issues can often lead to headaches, but not all headaches are vision specific. So you had a post that explained why people get headaches with driving specifically. And I thought that was really helpful because a lot of times driving, being a passenger in a car, can be really overstimulating and really challenging for people. So can you explain that for our listeners? Why is driving so challenging and giving people headaches?
Yeah, I think this is maybe a good way to tie in the subtypes that we had talked about earlier in this episode, is that concussions are broken up into so many different systems that can be not functioning that well and systems that can be aggravated post-concussion. So if we think and we break down driving, it is very visually heavy. You have to process a lot of your environment, more when you're the driver, but also when you're a passenger. I mean, you're sitting there, you're still looking at the world going by. Mm-hmm. There's other cars going around you. You have to be aware of did this person stop, etc. So there's a lot of visual demands to driving. Vestibular subtype, the movement of being in a car, the stop, start, and your visual and your vestibular system working together of am I moving? The world is moving by me, but I'm not sure if I'm moving. So that kind of confusion for your brain, it's kind of like the analogy I use for patients is if you are stopped and then suddenly you just stop and suddenly someone beside you starts going and you slam on your brakes. That is the perfect example of in a healthy humans, your vestibular system and your visual system getting confused. You're like, oh my gosh, am I moving?
Yep.
And that is, something we've probably all experienced in a vehicle before. Someone else just starts to move and you're like, oh no, what's happening? But imagine if that was happening in your brain the whole time you were driving. That would be exhausting.
Very exhausting. It's so stressful.
Yes. Yeah. And the stress piece of it, or autonomic nervous system, especially if your concussion came from a car accident, the anxiety around being in a car and being kind of hyper vigilant and so hyper aware of your surroundings can be a big, big driver for symptoms. Every single one of my patients who comes in post-car accident gets referred to counseling because driving anxiety is so prevalent. And again, this is the same thing with being referred to a concussion literate provider. If you get to see that counselor and they're like, you know what, you're tackling this really well, you're doing great. Amazing. But if we don't do that early and you don't get into it right away, then these things kind of fester and then they can get worse in the long term. So it's just so much better to tackle it from the get-go. So we've got visual, vestibular, we talked a little bit autonomics, cervical, so the neck component. If you're shoulder checking, if you're kind of like looking through your mirrors, your head is moving a lot when you drive as well. And this goes back to the stacking of all the systems that get used well together. Your neck, you're shoulder checking, you're visually looking for things. Your system is trying to decide vestibularly, where am I moving and what's going on in my world? All of those, if they're not working well by themselves, are going to have a super, super hard time working well together. So, and then there's the cognitive demand of driving. Where am I going? Where do I have to turn? What route do I need to take? Is there music on? Is that distracting me? Do I have a passenger who's asking me questions? Am I paying attention to my kid sitting in the back seat who's crying right now and I can't pay attention to where I'm driving? There are so many factors about driving that are cognitively and energy taxing. So this is why it's such a commonly difficult activity to get back to, or why it will cause headaches, dizziness, other types of symptoms.
Yes. Thank you so much for sharing all of that. And I think another combination, maybe it's all of it, but especially the visual and nervous system combination is if your eyes are not working together well and your brain doesn't recognize, or it takes a while to process where things are, or like what's happening, the depth perception, right? Like if things are off, your brain, that sets the nervous system off as well. Cause it's like, okay, I'm not safe. I'm not sure where things are in space. I don't know what I'm seeing. Or even if it takes a minute or like longer than usual to process that will add to that overall feeling of threat. So yeah, really well explained. Thank you for all of that. And it is something that is so, so common. And I don't know if people would recognize that necessarily, like in general. Again, it's not something that's discussed a lot when people talk about concussions, is how much driving can be impacted, but it is something that I hear all the time. Even if the injury didn't happen from a car accident, is definitely, especially if it did, but even if it didn't, this can be an issue for people who've had concussions. So that is really helpful to understand kind of why all of that.
Yeah. I love the point you made also about like the threat of the nervous system piece, because that's something I'm trying to teach my patients about a lot is, yes, technically it's your eyes that are maybe not working well, but our nervous system is very simple. Its job is to decide if you are safe or if you are not safe. And there's not a lot of gray in the middle of those two things. It is like, I'm good, I'm not good. And sometimes it can be so suddenly in the not good that's overwhelming. But like you said, if your visual system is not working well together, your brain's getting confused by that information. Now your nervous system is like, I'm not good. I don't know how to perceive my environment right now. I don't feel safe. And yeah, it can lead to like a whole host of symptoms.
Yeah, it's so intertwined with all of it. It's definitely something to be aware of. And I didn't know about it until I started working in this space. Like it's really important, and I think helpful for people to recognize. So I'm glad that you're out there advocating this as well. Like you need to know, this is important. So are there any other topics related to concussion recovery that we've missed, that we haven't talked about, that you're passionate about and want to make sure that we address in this conversation?
Yeah, we've touched on this a little bit, but I guess my like biggest point that I'm always trying to teach people about is that early access is don't wait like a month before you try to go see someone. Don't say like, oh, it'll get better. I'm going to I'll go if it's still there in 4 weeks. Like go ASAP, find somebody in your area who is concussion literate. And if you don't have somebody in your area, there are so many people that will help you find someone. You can reach out to me on Instagram and tell me where you live, and I will see if I know somebody who is a good concussion provider in your area, which is the coolest thing about being active in this space on social media. It's a very useful use of social media, as we have so much way easier access to people and knowledge and things like that. And I'm personally part of a group called Concussion Nerds, and there's people all over the world in this training course that we have taken. And then it's kind of evolved into a community that we can all connect and talk about cases that are challenging and refer to each other, because it's multidisciplinary. And so if you are struggling to find somebody who is concussion literate in your area, you can't access someone virtually or in person, That is definitely something you can do, is you can reach out to me on Instagram and I will see if I know anybody or can try to connect you with a clinic that has knowledge in this space, because that is the most important thing. Talking to someone who knows the concussion space. Like you said earlier, Bethany, healthcare providers don't get educated on this very much. There's like a lot of things healthcare providers need to learn. And this, for a very long time, was not on the list at all. And now it's a little bit on the list of education. So it's getting better, but it definitely can be improved a lot, which is why you want to seek out the people who are actively involved in the space all day.
Yeah, such a good point. And I love it is a community, like, and people want to help each other, like, because I think we're all kind of in the same boat. Like, we see the problems that this can cause, and we see that it feels so, maybe this is not a helpful way of thinking about it, but it feels so unnecessary. Like, there's so many people suffering so unnecessarily because there is help. This is a condition that you can recover from, and people just don't know. And so, like, getting the word out is so important. And yeah, connecting with people who know, who can then connect you with other people or whatever. Like, it is heartbreaking to me. And I hear it all the time of people who just didn't know. They didn't know what they didn't know. They didn't know that there were other answers out there, or they didn't have any access in their area. So yes, thank you for putting yourself out there. And yes, the coaching thing makes it possible for us to work with people anywhere in the world, which is so awesome. And we can be putting people in connection with each other. So I love that you're doing this too. This is like the best. I would love to have you share with people who your target audience is, how you help them, if it's in person over Zoom, and if people want to hear more from you or connect with you and talk about their symptoms and how they can get help, how can they do that?
Yeah, for sure. Thanks. And Bethany and I are both very passionate about making sure you can access care, because it is out there and there are tons of us who want to give this good advice and help you get on your journey, but it is very challenging as a patient. So for anyone listening who's had a hard time finding access to those things, definitely reach out. And Bethany had mentioned my Instagram earlier. This is the easiest way to reach me, is at concussion.physio, which is PHYSIO for anyone who's not in Canada. And so I'm on Instagram connecting with clients and patients and people on a concussion journey, and then other clinicians and other providers who are in the space a lot of the time. I also have a website, which is www.concussionphysio.ca. And so on that website, I'm not sure when this podcast will be out into the world, but it's currently under construction, but that won't be for much longer. So I imagine by the time this podcast is out, it will probably have all of my services listed on it, relatively self-explanatory. And you can always email me from there or kind of join my email list to be kept up to date. Clinically, for in-person rehab, I work in Victoria, BC, Canada. And so due to kind of like, as registered healthcare providers, like, I only provide clinical in-person care to people who are living in BC. And then, like Bethany had mentioned, the coaching space allows us to improve our reach so much. And so this was a big reason I got into the coaching space, is because I don't want to be constrained by geography in my ability to help people.
Me too. 100%.
Yeah, it doesn't make sense that I'm not allowed to tell somebody in a different area like good, easy concussion advice to help them. And so this is why I'm in the concussion coaching space, because I want to be able to help more people, and geographical borders should not be the limiting factor for you getting good access to healthcare.
Amen.
So I do a little bit of one-to-one coaching, but because I have a full clinical caseload in Victoria, my one-to-one coaching spaces are pretty limited because there's just only so many hours in a day. But this has led me to my next offering that I will be putting out very soon, is a group coaching offer. So I'm building out a concussion coaching course, and I'll have a group of people go through it together. And I love this because it'll allow multiple people on this journey, pardon me, it will allow multiple people on a concussion journey to be able to connect with each other, to learn from what other people are doing, and build the community piece of this that I feel like a lot of people would benefit from, but just don't always know how to get into. And with my kind of coaching calls, and we'll have a protocol that we go through, to get you back on track with your concussion recovery is the goal of that program. So if you're interested in any of those things, lots of ways that you can work with me, lots of ways you can connect with me. If you're not ready to be a client of mine yet, we can always connect on Instagram and kind of keep in touch. And then you can always kind of join my email list as well, which you can get to through my website or my Instagram, actually. And keep in the loop if there's a time where you feel like, you know what, I'm ready for the coaching thing. So yeah, lots of great ways to connect and build the concussion community.
Yes, perfect. I love it. I love what you're doing. It is like we are very, very much aligned. I love it. It's so important to get it out there. So find your people. This is really, really important. And
totally
for what you're doing, Brooke. I love it. It is exactly what's needed out there. So keep up the good work.
Thank you so much.
For being here.
Such a fun conversation. Yes, thank you. I was really happy to kind of join this conversation today. And now that we've had this whole interview, I feel even more convinced that we are very aligned in our love for this space.
Yes, me too. This is really good. And I hope that this conversation will be really helpful for people out there who are looking for hope and direction. So thanks for all that you shared. And we will be in touch, I'm sure.
Totally. Thank you.
I'm so glad you listened in today. I hope you have gained some helpful insights and inspiration regarding dealing with and recovering from concussions. My goal is to create more awareness and education about concussions and the fact that there is so much that can be done to improve life after someone has had one. Help me spread the message by liking, commenting, rating, and subscribing to this podcast, and share it with others who would benefit from hearing it. There are more resources available on my website. And again, if you or someone you love would benefit from concussion coaching, sign up for a free consultation using the link in the show notes or at my website, www.theconcussioncoach.com. Thank you. See you next time, and take good care of that amazing brain of yours.